Hey, welcome back to StickBrain. Today's story might make you very, very grateful for modern medicine. Before 1846, if you needed surgery, you didn't hope for a cure. You hoped you were fast enough to survive it. Operations happened in rooms with skylights, surrounded by rows of medical students packed onto benches. Because apparently, watching someone get cut open without anesthesia was considered entertainment. The only pain relief? Brandy. Opium, if you were lucky. Or a leather strap between your teeth. None of it worked. The assistant's entire job was just holding you down. Writer Fanny Burney underwent a mastectomy in 1811, fully conscious. She later wrote that she felt the steel scrape against her very bone. She passed out twice from the pain. The best surgeon of the era wasn't the most careful one. It was the fastest. Robert Liston could amputate a leg in 2.5 minutes, sometimes holding the bloody knife in his teeth to free up his hands. One operation became infamous. Liston was moving so fast he accidentally sliced off his assistant's fingers. Both the patient and the assistant later died of infection. And a spectator, watching from too close, was so startled he simply dropped dead of fright. 3 deaths, 1 surgery. Historians call it the only 300% mortality rate in medical history. Liston somehow still had a great reputation. Doctors didn't know germs existed. They wore the same coat for years, crusted in old blood, and actually believed pus forming in a wound was a good sign. One doctor, Ignaz Semmelweis, proved that simply washing hands reduced deaths dramatically. His colleagues mocked him for it. He died in the psychiatric hospital, never seeing his idea accepted. Then, October 16th, 1846, Boston. A dentist named William Morton used ether vapor during surgery for the very first time. For the first time in history, there was silence during a surgery. The patient didn't scream. He simply slept. The surgeon looked up and said, "Gentlemen, this is no humbug." It caught on fast, especially after Queen Victoria herself used chloroform during childbirth in 1853. And in the 1860s, Joseph Lister introduced antiseptics, finally starting to defeat infection too. Today, surgery means counting backward from 10 and waking up in a clean bed. For someone once strapped to a wooden table, that would have seemed like an actual miracle. See you next time. Subscribe and like for more.